Hello friends, I am Dr. Biren Nadkarni. I am consultant orthopedic and joint replacement surgeon. I am practicing at Holy Family Hospital in Sitaram Bharatiya Institute, New Delhi. Today we are going to talk about steroid injections, specifically steroid injections for the knee joint. I get maximum questions and a lot of problems people face about when I address them, when I tell them that they need injections in the joint, specifically a steroid injection. So steroid injections are basically indicated for the knee joint when the knee is acutely inflamed. It is very swollen. There's a lot of fluid in the joint because of conditions like gout, like osteoarthritis, rheumatoid arthritis, any problem of the joint which can increase the amount of exudation in the joint, or it can increase the number of the more secretions in the joint. So it's just like an injury to the eye. If your eye gets injured, your eye secretes tears, but the tears have the way to get out. But then in the knee joint, it all gets accumulated. And any swelling, any effusion in the joint basically indicates underlying injury, be it osteoarthritis, be it gout, be it sports injury. And these things have to be done at rest. But steroid injections are basically indicated mostly for, in our practice, we mostly do it for osteoarthritis knee or some kind of a acute flare up of a gouty knee in which the uric acid level goes up and it flares up. So why are people so scared of steroid injections? And steroid per se has a lot of negative connotation with its name, and people are used to taking oral steroids for other problems. But we should remember these are local injections. They are given in the knee joint, and the local injection does not have the same side effects as the systemic side effects of an oral steroid. So when are they indicated? They are indicated when the acute anti-inflammatory medications have not been helpful, the swelling has not got down, or the swelling is too much, which basically necessitates that the surgeon or the doctor takes some amount of the fluid away by a process called aspiration, and in the same process also injects steroid in that. It need not be necessary that every time aspiration has to be done. A simple steroid injection can be done in isolation also. So next question we get is how much duration the steroid injection will last. So steroids are basically anti-inflammatories. They are just like you have oral anti-inflammatories. This is an anti-inflammatory which works at a local level, and the purpose of this is to allay all the inflammation, reduce it, subside it, and bring it to a normal level. So the maximum time we have seen steroids work is about 3 months to 6 months, but sometimes people have been lucky, specifically in osteoarthritic conditions, it can go on at least a year and a half. But we normally say that the duration of effect lasts about 3 to 6 months. Uh, People also ask us what are the side effects, what are they going to face after a steroid injection. And what we normally see is some kind of acute flare up, which can last for about 2 to 3 days. There could be a local pain because of the injection per se, which you can have after any injection. And that flare up is basically not more than 40 to 72 hours. It can be managed well by basic anti inflammatories and a lot of ice packs. And we also advise our patients to lie a bit low, not to be very aggressive after a steroid injection. And thereafter, the effect of the steroid starts taking place, the patient feels more comfortable. How many injections can a person take in a year? As per literature, as per reports, for osteoarthritis knee, a person who is having recurrent pain and inflammations and effusions, about 3 to 4 injections can be administered in a year. Of course, we need to work up the patient by basic x-rays and MRIs first and see if any other mechanical factors are causing this kind of effusion, which has to be addressed by different means, maybe arthroscopy or a debridement by arthroscopy. But if all these reports are normal and if there's a systemic response or if there's an inflammation happening in the knee, we can give about 3 to 4 injections a year. So a person who is awaiting knee replacement surgery, sometimes who has very bad knees and has already been advised knee replacement, they sometimes have this specific request or query for delaying the surgery for some time and getting a steroid shot in the meanwhile, just to get some relief for some time and thereafter consider replacement after maybe a few weeks or few months. We have seen that a steroid injection given immediately before surgery, there are some specific side effects because the steroid, as a response in the joint, it might actually increase the incidence of infection also. So we have to maintain a time gap between a steroid injection and a surgery like a knee replacement surgery, which should be at least 3 to 4 weeks. This is the norm I follow in my practice, and it is followed worldwide also. So, how successful are steroid injections? Steroid injections is not, it's basically offers symptomatic care. It is not treating your arthritis, it is not reverting it back to a normal state of cartilage. In fact, given in excess, it is actually sometimes detrimental to the cartilage also. While we are operating, doing a knee, we sometimes see steroid deposits in the joint also, specifically people who have taken steroid injections multiple times. So we need to be very sure what are the indications, why are we doing this. So we are only doing a steroid injection for a acutely inflamed knee, especially in osteoarthritic knee conditions, where there's a lot of fluid collection happening, there's a lot of inflammation happening, there's a lot of synovitis. Synovitis is basically inflammation of the joint of the joint of the lining of the cartilage, and which leads to a lot of pain, stiffness, and patients are not able to walk and do their normal activities. So it basically offers a temporary relief for some time. It should not be considered as a cure, and it has very specific indications where we actually consider steroids for osteoarthritic knee. So, friends, I think my discourse has been able to answer most of your queries about steroid injections. And if you have any queries about steroid injections specifically for the knee, do write to us or mail to us. Thank you.